Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen, and I'm actually filming this episode from my house. I've got the Michelangelo Sistine Chapel vibe going, and my guest today, Dr. Luke Cicchinelli, has to have one of the most interesting podiatric journeys of any doc in the profession. Dr. Cicchinelli was a 1986 graduate from the North Carolina State University. From there, he went to Temple University, and then he did his 3-year surgical training at the Emory University Northlake Regional Medical Center in Atlanta, Georgia. Dr. Cicchinelli is currently the Chief Medical Director for Pica, Podiatry Insurance Company of America. And in the past, Dr. Cicchinelli has practiced in Australia, Spain, North Carolina, Arizona, back to Spain. So I don't think we're going to be at a loss for things to talk about, Dr. Cicchinelli.
Thank you, Jeff. My pleasure to be here. Thanks for having me. And you're doing an awesome job. I've watched many of your episodes, and I think what you're really doing is communicating a tremendous diversity of backgrounds for our incredible profession. So it's really wonderful. So I'm pleased to be here.
Fantastic. You know, we'll talk about your mission trips too. I noticed you've been to 19 different countries, so we're going to touch base on your whole career over the course of the next hour, Luke, and I'm really excited to have you here. So I thought the first thing we should talk about is your new role with Pica as the Chief Medical Director. Can you talk about, how that came about? And you've been there for almost a year now, right?
Well, a little less than a year. I started May 5th, I think it was. So maybe 7-8 months or so. But so I've been on the committee. I mean, I've been a long-term Pica policy holder my entire career. My wife as well. My wife's a podiatrist as well. Everything I always say is we, is certainly not I. So I was on the committee myself for the medical advisory committee with Ross Taubman and all the other members for probably 8 or 9 years. And then in Spain, the last 8 years, I continued to, with COVID, well, prior to COVID, come back for a couple meetings a year, and then with COVID, tag in remotely and so forth when we had meetings. And eventually Ross started to consider his next step in retirement and so forth, and started to talk about who might come in and replace him, and sort of do a little bit of a search for those people. And so I stuck my name in the hat, and my wife and I thought that, well, this would be a neat opportunity if I was the right candidate, and if I were to be selected, and sort of a neat opportunity to give back to the profession in one more, I guess I would call it another facet, right? I mean, it's a big pivot from private practice into a medical director role within Pica, but it requires knowledge of clinical skills, sort of an opportunity to use what my wife and I had both acquired through our careers, maybe, and certainly, as you already alluded to, all the places that we've gone and things that we've done. And as a family as well, we have 3 children, so all, kids in tow, at least for the last 20 plus years. And so it's just a neat way to kick back to the profession. I mean, we've spent so much time overseas. I mean, roughly my career, myself and my wife, who she stepped back from actual clinical practice a while ago, but let's just say 20 years in the United States and 10 years overseas, if you want to break the last 30 years down in that fashion. And so with aging parents, my dad and her mom and brothers and sisters, and so it was time to sort of think about coming back. And so coming back, we've always liked to build on our professional experience and continue to grow, continue to learn, and continue to contribute. And so this job really seemed to tick all those boxes. And so I was thrilled when selected. And I just really feel like it's a neat opportunity to give back to our profession on the American side of the pond in a different facet. I like the word facet. I mean, I think all our careers, yours as well, many of the people you've interviewed and all our other colleagues out there, many people have sort of multifaceted careers. And so I think that's probably the common sort of word I would associate with this job.
Oh, I like that. Luke, that's interesting. I was a Pica policy holder my entire career also. And then fortunately, I never needed their services for malpractice, but it was always nice to know they were there,
Well, I'm glad you never needed them. And the job is so diverse on a daily and weekly basis as to supporting, let's just say, supporting and protecting the reputation of our policyholders, our colleagues, and of course, protecting patients and protecting our policyholders. So there's so much that goes on. Continuing medical education, obviously there's claims, there's administrative defense issues, hospital privileges, credentialing, insurance issues, Medicare audits. It's really, really sort of fascinating and enlightening and eye-opening all at the same time.
Wow. You segued right into what I wanted to discuss, the day in the life of a medical director at Pica. Because usually when we see each other, we're at meetings and you're giving risk management talks or something, and we have time to chat. But, what does a day-to-day look like for you? I mean, you just kind of gave an overview, but are you traveling? Are you mostly working from the office? And what is your percentage of time dealing with different things?
Well, so I do. One of the nice attractions of the job, frankly, was the ability to work remotely. So I'm talking to you from Philadelphia, where my wife and I have maintained a residence for about the last 15 years. And my father, I'm living with my father, and my wife is here sometimes, and sometimes she's in Spain. And right now he went back to Italy, where he's been living for 30 years. So we have this sort of, I guess, background, international background over the last 20 to 30 years as a family. So the daily basis, though, is a mixture of, let's say, participating in claims review committees and reviewing claims that come in is a portion. There's another huge portion, which is around risk management education, risk awareness education, developing content with our medical advisory committee members, our marketing department. Certainly, there's a tremendous amount of travel at the different meetings. We support in a sponsorship fashion, as you're aware, many endeavors around the country, be it student recruitment through your own association with the deans. We have sort of affinity relationships with lots of state associations and other organizations, ACFAS, APMA, Florida Podiatric Medical Association. So there's a lot of communication and conversations in that regard. And then there's also other lines of business, right? So we also, as a group, insure dentists and chiropractors. And even there's an arm of lawyer care, right? Legal malpractice considerations. And so there's never a dull moment, right? So, I have learned a lot and appreciate a lot of philosophy sort of in my education and in my reading and my hobby. So, sort of like the Stoics, the obstacle is the way. And you just sort of deal each day with, you go toward whatever sort of is, whatever the obstacle is, you sort of go toward that and you try to deal with it, right? By the way, it's funny that you have that picture of the cover that, from the Sistine Chapel on the wall behind you, because my wife and I have the exact same picture in our living room. We had it in Arizona, and then when we moved to Spain, we moved most of the house to Spain. So we have it in the living room in Spain. And one of my favorite lines that I use teaching the Spaniards when they complain about, well, it's, surgery, the education is hard and this and that, I always used to joke with them. I said, well, if life was supposed to be easy, Michelangelo would have painted the Sistine Chapel floor instead of the ceiling. So
I love that.
I think in our daily lives, that's just sort of a good attitude. And I think with this job, as I'm sort of being onboarded over a year here, you're learning different things. There's some things I've never dealt with before. Other things are certainly within, yours or my wheelhouse, and many, many other people's, medicine and surgery and things we've dealt with our whole careers, right? And then there's the insurance world, right? So I have a lot to learn and assimilate there. But yeah, it's fascinating. There's never a dull moment.
No, that makes sense. I keep this Michelangelo painting in my office and / den because every time I walk in here, I look at it and it reminds me of all the wonderful trips to Italy and the awe of the great artists of the Renaissance period. So I love it.
Well, it's fascinating because art and literature and sort of beauty and poetry and these other sort of parallel universes to medicine are so important and give us such context in life. For myself, I really believe that we sometimes get very myopic in the United States about what we just do on a daily basis and healthcare and so forth. And you meet someone many people as you travel whose world has nothing to do with that. And they're fascinatingly bright and creative. And there's just, so I love it. I love that you have it there, but I also love your comment that you just said and all this sort of sentiment behind it, because I completely share that. I mean, and that's why we've done so many things that we have done. We've taken a different path, right? We wanted to take a different path. So that was sort of an act of a deliberate decision.
Sure. Before we talk about that path, I had a couple more questions to ask you about ProAssurance and Pica.
Sure.
You know, when I went from practice to being a dean, I had a vertical learning curve. And then when you mentioned that you were interfacing with chiropractors or dentistry or legal malpractice, what's that learning curve like, Luke?
So I think I realize is that in this sort of space, right, in the insurance space, I mean, their considerations and concerns are very, very similar. It's not that big a reach, right? They're healthcare providers, not the lawyers, right, in the legal care, but the others, dentists and chiropractors, they're healthcare providers. They went into a profession to try to help others, and that's what their concerns are as well. And then, of course, we're in the insurance industry, right? So the insurance industry in any avenue, could be car, could be life, it could be anything, could be medicine, right? It's to protect you and help you navigate sort of unseen situations or unforeseen situations that arise. So there's a lot of sort of similarity there. And it's very informative and educational to be meeting other people who have different healthcare careers than I have had. And yet, again, the focus is really the same. They're attending to patients with concerns. Something may go sideways. And so we're working through that. And of course, we have an incredible team of claims handlers and legal counsel. And so, you know, the job is exactly sort of what I expected and anticipated as an opportunity to continue learning and sort of expanding the brain, right? I like to be a continual learner, just like we talk about a lot in our own careers with medicine and surgery. And so I'm constantly learning something new, and that's sort of invigorating, and I enjoy that. Yeah, it's invigorating. That's a good word.
Let's talk about the road less traveled, right? When I was going through your CV, Luke.
Robert Frost, one of my favorites.
There you go. When I was going through your CV, I had this vision of, when Luke went to get his zoology degree at North Carolina State, and then he went to Temple and got his surgical training. Did you have any idea that you were going to be practicing in Australia or Spain and doing all these mission trips? I mean, how did this all lay out for you?
Well, the answer to that is none at all. Certainly not leaving high school. Certainly not leaving high school. But I've had similar questions throughout my entire career about sort of how we have decided as a couple to do the different things that we've done. And I will say that there's probably like sort of three common denominators. And interestingly, it probably doesn't show up on my CV there, but I was a college soccer player for NC State. So I played soccer for NC State. I was a goalie, and we were really good. We were, in my sophomore year, we were third team in the country, Division I, and this was also back when Jimmy Valvano was the head coach of the basketball team, and we were a very international team. And so what I learned very quickly in college, I grew up in New York, in Albany, New York, and I went to the South. Never been out of New York State before in my entire life, really, at 18 years old. And then the international flavor of our team, and we were really, really good. ACC, Division I, and we had 5 Nigerians. We had 3 teammates who had Indonesian roots. We had a bunch of us Italian, sort of New Yorkers, last names, right? We had a guy from Argentina. We had a teammate from Holland. So we had a guy from Kuwait. We had a guy from Jamaica. So this international background, and believe it or not, it dovetails with seeking to go into podiatric medicine and surgery as a career due to soccer and sports medicine interest and so forth. that sort of set me off on this path of my own sort of grandparents on my father's side being Italian immigrants, and then my mother's side of the family was from Scotland, and just sort of embracing sort of diversity and international sort of what I call cultural intelligence, and then going on to Podiatric Medical School in Philadelphia, where I met my wife. We were a year apart in school, and DeeDee grew up in Puerto Rico. So her native language was Spanish. I didn't speak a lick of Spanish at that time. I'd never studied Spanish. I'd never studied, our parents had us take Latin in high school, which was back sort of in vogue back then. I even took a couple years of Latin in college. But anyway, that sort of tied into meeting her. And then as I went on to my residency, we got engaged and we got married toward the end of the residency. But her native language being Spanish, tying into this sort of international feel through college with soccer, and then getting married, and then deciding very quickly that I would like to learn Spanish for the relationship and communication. And then in parallel, there's a lot of things that went on. Believe it or not, in my junior year of college at NC State, my father accepted a job in Sydney, Australia. And so he became essentially what you'd call the vice dean or vice chancellor of the University of New South Wales in Sydney. And so my parents ended up living in Sydney for 10 years. And so that sort of then blended into Podiatric Medical School in the residency years. And then a bunch of Australians came over to the Podiatry Institute to do the mini residencies that we always ran, with Dr. McGlamory was still practicing full time. Of course, all the wonderful teachers, Stan Kalish, Jim Bouchard, John Rook, Alan Banks, Tom Smith, the list goes on, Tom Kane, everybody. And so a bunch of Australians came over to do the mini residency. My parents were living in Sydney. I was finishing the residency. DeeDee and I were getting married. Some Spaniards came over to train as well. It's really interesting, too, because that was pre-internet days. I'm not even sure how they all even figured out where Atlanta was, or that we had a mini residency. Print media, certainly the McGlamory textbook had come out, but it's really interesting to think of the pre-cell phone world, pre-email world, and all those folks that came to train in Atlanta, and all those sort of dots that have connected over the last 30 years. It's really fascinating. So I know that's a long answer to your question, but I believe that very early in my life as an undergraduate at NC State, the international sort of sensibility got on my radar, and it was only further reinforced at every sort of step of the next bunch of years. And then we as a couple actively sought out to bring that to our children and sort of go down a different path than the typical path of private practice until you sort of retire one day, and then you maybe start to do things that you'd always wanted to do, right? So we wanted to live in a more deliberate fashion, and we certainly have, and we continue to, and we will always continue to, with the kids. It wasn't like we were, just doing it on our own, right? So it was very, very enriching as a family, very enriching.
A wonderful experience. Let's talk about when you were in the States practicing. You were in North Carolina, and then you were also in Arizona. What was that like for you? And were you in practice together with your wife? Or
loved it. That was, absolutely. So after the residency in Georgia, I'll tell you a funny story not many people know, but my wife and I both were very interested in humanitarian work. It's one of the original interests when we met. And so as I was finishing the residency in Atlanta, and she had done her residency in Tennessee, and the finishing times were staggered a bit because mine was a 3-year program. She had done a 6-month preceptorship and then a year residency at the Mountain Home VA program in Tennessee. At any rate, we decided, this will probably blow you away, but we decided we were going to apply to the Peace Corps. So we applied. So we applied as a couple to the Peace Corps, finishing the residency in Atlanta, and we were denied. We were not selected. And So I never applied for a job. I never looked for a job anywhere. And she, believe it or not, some of maybe our colleagues wouldn't necessarily understand this nowadays, but she was actually working at J.C. Penney's. Incredible, really. So she was working at J.C. Penney's while I was finishing the residency, student loans times 2. And we hadn't really applied for a job. And then we got denied by the Peace Corps. And so we said, well, what are we going to do now? And at that exact same moment, the Australians said, hey, how about teaching us? How about coming over here and teaching us as we start to sort of get going with podiatric surgery here? And at the same time, 2 docs in Madrid said the same thing. So I looked at my wife and I said, well, honey, this is the perfect opportunity for us to, before we start a family, travel a bit and sort of decompress from pretty intense residency years. I love to teach. And also my opportunity to learn Spanish. So we ended up going to Australia and then going to Spain. And then you asked about North Carolina. So Spain and Australia became out a 2-year cycle. I learned Spanish in Madrid, old school, studying books, again, pre-internet and all that, studying grammar books, studying verb books. And we came back and we went to North Carolina and we joined a gentleman in practice for about 6 months. And that wasn't really an ideal situation. And so we then ended up, DeeDee took a job in Winston-Salem with Jim Mothershed. It was wonderful. Rob Mothershed, his son, later went on and it runs that practice now, but also did the residency in Atlanta. And then I went to Eastern North Carolina, and we ended up living apart for 1 year, traveling back and forth on the weekends to try to get a start. And a gentleman in Greenville, North Carolina, Dwayne Kratzer, was retiring, and we bought his practice. And so we ended up practicing about 11 years together in private practice, which was wonderful. We loved practicing together, which is a great, I think, aspect of what our profession offers. If you get into that, I know you've certainly talked about a lot of things like that with other people you've interviewed on your Dean's Chat. So we loved it. We practiced together for 11 years as we started the family, and we had a couple partners join us, Chris Gall and Ken Rosenthal, and it was wonderful. But then after the kids started to get to an age, they were 8, 6, and 4, we pulled the rug out from our lives, and we took the kids to Spain for a year. We sold our practice to our partners, and the kids were 8, 6, and 4, and we packed up, you'll laugh at this, we packed up 14 suitcases, and we ended up in Spain with no place to live, no job, and we found an apartment, and we set off on a family adventure for 1 year, and then we came back, and I taught podiatrists there, and I got involved and so forth with colleagues there, but it was dicey. And then we did that for a year, and then went to Arizona for about 7 years before sort of officially in 2015, with the kids now at a little more interesting age, high school, junior high, we did it again. And that was what the last 8 years was prior to accepting this role with Pica in May of this year. That's kind of a sort of a bullet point from North Carolina to present.
No,
It's been a wild ride.
I've got a couple questions to ask. One is, how old are your kids now, Lou?
Angelica is our oldest. Angelica is 24. Estella is our middle daughter, and she is 22. And our son, Gianluca, is 19.
Do you mind sharing with everybody the opportunities your kids had and the impact that had on them throughout their, growth years? Because a lot of kids don't want to leave when they're in high school or middle school,
Well, I'd be happy to. There's no blueprint. I don't think there's any blueprint. I think I like to say to our kids, move. I think a reasonable game plan in life is move gradually in the direction of things that make you feel more comfortable. And then I like to say, and it surprises them, perhaps I say, when you get there, I want you to stop and enjoy it for a while. And then I want you to sort of blow it up and sort of stand on top of the heap and look around and say, okay, what next? And that's really what we've done with them. And the sort of destructive part of that, sort of the creative destruction part of that, when I say blow it up, that can be painful, right? That can be very stressful. So to answer your question, to share with them right now, they're fully bilingual, 100% bilingual, sort of global citizens, and they have a tremendous perspective of, at a very young age, of life. And yet that doesn't mean it was easy for them, particularly, there's two phases, right? When they were 8, 6, and 4, it didn't even register really, right? But when they were 16, 14, and 12, and Angelica was going into her junior year of high school, and Estella was going into freshman year of high school, and Gianluca, I think, was going into maybe 5th grade. So that was very traumatic. That was traumatic, particularly for our middle daughter. But like I said, if you move toward something, you sort of come through the woods. And so I think if you were to interview all 3 of them today, in fact, I know, they went through a very, very challenging adjustment, and so did we as parents, quite frankly. We questioned during those first 2 years, have we done sort of the craziest thing you could imagine? Or will this all shake out okay? And now literally, 9 to 10 years later, after their more formative years at that age, which you can appreciate as a parent, right? Having come through all that, I would say to you that what we feel as a couple is that we really, and they would agree, the kids, that we gave them it's almost Christmas here, right? So we gave them a Christmas present that they opened up gradually over 8 to 10 years, rather than they opened up in one sort of fell swoop on Christmas Eve or Christmas Day. That's how I would sort of give that to you. And I genuinely believe 100% that that's, what we've done and they've realized, right? And they'll enjoy the rest of their lives. And there's so much, people sort of, well, you're an educator, right? You've been an incredible educator, right? The dean currently where you are, Barry, plus your background of, clinical trials and so forth. So people know about cognitive intelligence and people know about emotional intelligence, but there's also cultural intelligence. And I think that what the world needs constantly, and look how diverse our profession is, and look how sort of it can only help people when they're more culturally aware of how everyone doesn't always think or do the same thing or believe in the same thing or have the same values or considerations around what our daily life might be like. So I think the kids are really tremendous beneficiaries of that, and it can only serve them well as they go on forward into their young adult lives and on to mature adults and upward, right?
Absolutely. On a smaller scale, my wife and I did the same thing. We kind of pulled the rug out on our kids when we moved from Evergreen, Colorado to Miami. Talk about culture shock, right? And
yeah, there you go.
But in a similar vein, Luke, I think all of our kids would say it was one of the greatest experiences they ever had.
Well, there you go, right? So I'd be tickled to hear a little bit about that as well. So, right, it's out of the comfort zone. The growth in life is outside of the comfort zone, and what's challenging for folks is to make that call. You make the call, and I'm so tickled to hear you did that, and that you believe that your kids fully have sort of appreciated that, as ours have, because if you sort of pivot back to some of the philosophy and so forth, and we could go down that path, but you're the interviewer. I'm going to answer your questions, but suffice it to say that everybody dies, Jeff, but not everybody lives. And getting out of the comfort zone is where everybody has the right, the absolute right, I believe, to live to the absolute fullest within the parameters that they would like to, that they define, that they identify, and that they choose to do, right? And so you've done it, it sounds like. We've certainly done it. And it's very enlightening and enriching, and you just keep growing. And you never sort of feel any sort of stagnation, right? I think stagnation's a dicey word, and I think stagnation is something that people may deal with more frequently than they would like to, right? So it's nice to hear your children did that as well with you to Miami.
Like you said, though, you just got to make it happen. Just do it. Make the decision. Make it happen. Luke, I'll share just a quick story. So my kids, we gave them all veto power, right? We sat them down in the living room and said, Dad's got an opportunity in Miami to be the dean. Well, if we have any dissenters, we're going to stay in Evergreen. And everybody got on board. My oldest was like, well, he was finishing high school. So I'm going off to college. And then my second oldest, he's a soccer player. He played D1 like you. And he ended up going to,
wonderful.
to Ohio State. But had he not gone to Miami and trained with all of those great soccer players from all over South America and Caribbean area, he probably wouldn't have done that. And then my daughter also played soccer, and my youngest son. I mean, they all. It was humbling to go to a soccer field, and we were the only ones that spoke English, right? I mean,
yeah, right.
Anyways, there's a lot of parallels there, Luke, and I share the exciting times.
Well, but what's interesting about that was soccer, and it's interesting in the international community of our profession. Let's just say lower extremity, foot and ankle medicine and surgery, right? And I learned it in college with soccer, and I'll bridge it all the way to our profession. There are universal languages, and when you get in a mixed crowd, soccer, you don't really need to speak the same language. It's like a lot of sports. There's that body language, there's the eye contact. It's a fluid game, right? So soccer is an international sport, and all over the world, people who aren't necessarily speaking the same language, native language, are on some of the world's best teams and completely in sync. And with podiatric medicine and surgery, it's been my distinct experience around the world and I even wrote an article for Podiatry Today once years ago about it, and I called it sort of seeking fluency in foot and ankle surgery. And the common denominator around the world of our profession is the anatomy and the medicine and the content. And so you can still interact even when you don't necessarily speak. Like I've been in Iran a few times. I don't speak any Farsi. Of course, they do speak English. I've been in a lot of places between the Middle East and Europe, and certainly Central and South America. I speak Spanish, so that's not an issue. But, the universal language is sort of the subject, right? So it's kind of cool when you look at it that way. Then you find the commonalities rather than what makes people different. You find what's in common, and you go toward that.
Look, I love that analogy. I hadn't really thought about it like that, but I love it. Yep, you're right. So you and I think you're going to Iceland, right? To the International Podiatry Federation meeting?
I will be, yeah.
I'm going too. And I think
it's wonderful. I didn't realize you were on that list. I know a couple Australians. Mark Gilhaney's a buddy of mine for 30 years. I know he'll be there from Australia. So it's wonderful. Well, that'd be phenomenal.
We'll put that commonality to a test for a few days.
Absolutely. That's going to be great. And the international community is I think there's lots of synergies to be fostered in the international community for our profession. Really, there's educational differences, which are not small, right? There's big educational differences, but there's lots of bridges to be built and then to be crossed. So I look forward to that. That'd be wonderful. And that you'll be there, that'd be great as well. That's going to be super. And Lee Rogers, I know, I believe he's maybe the treasurer. I think he's certainly on the board of directors or organizational structure there. So this will be great. Yeah, that's cool.
Yeah, it'll be a lot of fun. Shifting gears a little bit, Luke, when I was the dean in Miami, one of our classes ended up generating 9 couples.
That's awesome.
There's a lot to be said for, you're entrenched in the podiatric medical education journey, and people in close quarters, of course, are going to get to know each other. But to this day, I'm helping couples in school, give them guidance on where they should do their residencies, hopefully set the stage so that at least they're near each other and maybe not in the same program. Can you share with us, your family, your wife, and the experience going forward in podiatric medicine? I mean, I realize there's the whole life experience, But how's that played out for you? Obviously, it played out very well.
Well, I think it's played out phenomenally well. Phenomenally well. Very grateful for that. And I'm grateful, of course, to my wife. And I think, to try to answer you in the most sort of sharing fashion, our profession really is a phenomenal profession for allowing couples to mutually pursue a career and yet maintain enough of individual identities that may resonate more with each of their desires. So I'll take myself and DeeDee. So my career was distinctly reconstructive surgery and sports medicine, and hers was diabetic foot care, and she even got a certified orthotist degree and dealt with wounds and more sort of orthotics and so forth. So in private practice, our interests were complementary, and that was nice. And then as far as a couple practicing together and being from and of the same profession, there's tremendous opportunity to sort of kind of understand each other's daily flow and what you're going through. And, you know, healthcare is intense. I mean, I've thought my entire career that there's very few professions that sort of ask more and demand more of healthcare professionals. And I include everybody in there, from nurses and CRNAs and doctors and healthcare, you know, even administrators and so forth. I mean, we have a demanding profession. So I think there's a lot of support you get in a strong relationship of having met in school and understanding sort of what the weekly and monthly tasks are of attending to people's wellness, people's healthcare issues. And then there's something else that's really important, and that is that if you wish to start a family, then things change for the woman, right? And we have incredible women in our profession. And I can speak from experience. So no one, I don't think, could accuse me of speaking for anybody else, because my wife and I have 3 children. And so I witnessed firsthand the decisions that our female colleagues have to make. And they do make, and depending on their own choices, right, about stepping back from practice or modifying practice as children come along, and then you want to perhaps raise the kids yourself rather than maybe, you know, there's lots of ways, right? You could have daycare, you could have a nanny, you can do different things. But so people as a couple can make those decisions hopefully together, right? And so it's just really kind of wonderful to share the family experience with the professional experience and do that together. And there's a little funny thing that I've always reflected on, is when I've run into other couples and they're like, well, we could never practice together. We could never practice together. And my wife and I were opposite. We loved practicing together. I mean, it was really great. And I've always thought, well, if I couldn't practice with my wife, I mean, who could I really practice with? You know, as far as, you know, sort of getting along with somebody, right? So yeah. That's neat that you have had, you know, that you're influential and sort of a mentor in that capacity to so many couples, because I really think it's wonderful. And I think our profession really sticks out as a great profession to allow that. The people, you know, be involved at whatever level they would like to, and keep what I call work-life harmony, the harmony together of living your life and being a professional, and yet not letting that professional role necessarily dictate who you would like to be as an individual, as a couple, and as a family. It's really nice flexibility there.
Well said. You know, the irony of this discussion is I was texting one of my students who's doing his residency in Michigan right now, Ryan Woldall, and his wife, Laura Truby. They together went to Michigan. They're in different programs. And I asked him if he'd be on my show to talk about you know, what it's like to be married going through this process. So it's funny we're having that discussion right now.
That's wonderful. That's wonderful.
In our family, my wife is an accountant, but I remember being in school, she would quiz me with the flashcards on anatomy and things. And sometimes she picked it up quicker than I did.
I had that experience when my wife started to back out of private practice after John Luca, our son, came along. After each child, she went like one day less in the office. And then after the third child, she said, I think I'm going to stay home for a while. I want to be sure we're raising our own kids and so forth. And so I said, well, sure, let's do it. And then I had all her patients. We hadn't brought in a partner yet. And so then one day the staff comes up to me and said, Dr. Cicchinelli, patients are asking, when will Dr. Roman be back?
Uh-oh.
And I realized, but that's none of us is the right flavor for everybody, right? I had my own patients and she had her patients, and people like certain docs for different reasons and so forth. So yeah, you joked that your wife maybe picked up some things passing you. My wife took better care of lots of patients in a fashion than I did, and certainly I had my strengths and the things that I offered to patients that weren't in her wheelhouse either, right? So that was great. It's complementary.
Absolutely. Thank you for sharing those stories. Those are great. Luke, if you're not pressed for time, I've got some more questions for you.
I'm not pressed for time at all. I love chatting, and I'm enjoying it very much.
So when you and I met in Nashville last summer, just to catch up and chat, we were talking about different ways of how podiatric medicine portrays itself to the outside world. And then I keep hearing you telling me that, Jeff, it's movement, keeping people on their feet, keeping them active, keeping them, not giving up their the independence. Could you talk about that a little more? Because I thought that was one of the most insightful discussions I've had in a long time about the direction our profession should be going.
So I'm happy to talk about that because it actually, I think, sort of fits into my wife and my own life view in a sort of a parallel fashion. So let me put it to you this way. We spend about the first 20, 25 years of our lives doing many, many things for the very first time without necessarily having that register. And then we spend the last 10 to 15 years of our lives doing a myriad of things for the very last time and being painfully aware of it. That this will be the last time that I'll go for that hike, or that I'm physically capable of going up that mountain, or perhaps water skiing, or perhaps dancing, or all these activities. So to bring that sort of reflection back to your question, it is about mobility. It is about staying active. It's about staying independent. And what our profession does is we help people to continue getting on, getting going, staying, doing the things that bring them quality of life. And quality of life, and even right down to treatment of depression and other sort of mental wellness topics, is about nature. It's about the air. It's about being outdoors. It's about having hobbies. It's about being engaged with others and socially enriching interactions. And when people are in pain or their lower extremities no longer allow them, they sort of get up and go, their world shrinks. And so I'm totally passionate about that. And I don't necessarily remember everything we talked about in Nashville. Well, I remember us sitting there talking, and I mean, I know I can go off on some tangents and so forth. I can get my passion bubble floats fairly close to the surface, as they say. But it is about keeping people moving. And that's why they seek us out. And that's why we have such a critical role in just even right down to plantar fasciitis and other conditions, tendonitis, Achilles tendonitis. And certainly we all get the importance of sort of the at-risk foot management and infectious diseases and diabetic foot care and prevention. But our role is to keep people not having to depend on others, because that then leaves them feeling like they're a sense of burden to somebody else, whether it's their family or a caretaker and so forth. So it is about mobility. It's about quality of life. It's about staying functional. It's about being able to still sort of fend for yourself. That's how I see it. We're helping people still fend for themselves and not necessarily feel like they're sort of infringing on or sort of drawing a blank on the word in English, but and sort of being sort of being a hassle to somebody else to sort of help them around, right? It's really important how people maintain their independence.
Bingo. The independence thing is so important, and they don't want to be a burden to people. And I agree with you. Podiatry keeps people on their feet, moving around, doing things they want to do. So that was great. I just really enjoyed that discussion, Luke, and I love how passionate you are about that, and you're so eloquent about the benefits of podiatric medicine. Let me ask you another question, because you and I are working together, of course, on the student recruitment initiative. Thank you again. Pica's participation is so important.
Absolutely.
What would you tell a college student who wants to have a career in the health sciences? What would you tell them about podiatric medicine and pursuing it as a career?
I would tell them to define what interests themselves mostly in their life about staying active and functional and their own hobbies, and see exactly how our profession can help them communicate that sort of inherent interest of their own right to the patient community out there that has similar problems, because our profession offers the ability to help people in almost every facet of wellness that you could imagine. So let's say somebody says a pre-med student has had psoriasis their whole life. They may associate very quickly with dermatology or maybe having seen a grandparent who suffered before some of the sort of disease-modifying drugs came around, who suffered from psoriasis or psoriatic arthritis or something like that. And you may have someone else who was a competitive, soccer player like your kids or, myself in college and so forth. And you may have sports medicine injuries. And you may say, well, how many people here have ever had a sprained ankle and realize how it slowed you down? And you have an opportunity in our profession to deal with that. And then you may have somebody whose family, an aunt or uncle ended up with an amputation from ischemic disease or diabetic complications, right? So the reason I answer you by saying have them identify what interests they have of their own is because I believe that's where life is the most enriching. And that's what we have done as a couple with our kids. What we did was we stopped after residency training and we said, okay, what do we want our life to look like? And we went after that. And I would give the exact same advice. And in fact, I do when I interact with students and so forth. I want people, or at least I recommend people, pause and say, what do you want your life to look like, right? Everyone has unique gifts. Everybody has a unique skill. They just need to identify that if they haven't stopped and sort of thought about it. And then they need to go see who will be the recipient of their unique gift. And if they can ask themselves those questions early in life, then they can create the path that they would like and create their own life as it goes forward, rather than sort of following the crowd because you believe, well, I should be doing this because that's what everyone else seems to be doing. And that certainly can be an effective way. But you know what I find, Jeff? You probably found it yourself as well, because most have, is that people get to 45-ish years old. And the very common sentiment is people will stop and they will say, is this it? Is this all there is? What else? I've been doing this for 15 years, 20 years. Is there anything else? And my response to that is to start very early, defining right down to your question, pre-medical school, choosing podiatric medicine and surgery as a career. Think, well, what is it about myself that I would like to share with the world through healthcare? And I'm going to go after that, and I'm going to define that, and I'm going to make that happen. And you can do it. Anyone can do it, but it takes some introspection. It takes some sort of intentionality, some deliberateness, right? It's living the deliberate life, right? Living the deliberate life, like Henry David Thoreau, to find when you come to die that you had not lived, right? You need to sort of be deliberate in your decisions.
Absolutely. Just a little tangent on that, just to kind of put impact into what you said. I've learned with the students that if I want them to do research, we have them do student-initiated research. So they're doing research on things they want to study, not things I want them to do research on.
You just nailed it.
It carries through.
You just nailed it. You ask them to identify what it is that interests them, right?
Yeah.
And then they engage.
Yeah, then all of a sudden you have 54 students all involved in different research projects that they initiated. It's awesome. So that's so fun. Luke, we could talk all day long. What do you do? I'm going to shift gears on you again. I apologize. What do you do to relax? What do you do to recharge the battery, Luke? I know you're so busy. There's got to be some things you do. You're active and all. How do you recharge the battery?
So I recharge my battery based around what I've always called the four-legged stool of life. So I believe that we're almost balanced and well when we sort of try to get the four-legged stool of the mental, the physical, the emotional, and spiritual all on the same level. So on the physical side, I'm training for, I think, my 25th marathon right now. I'll run number 25 in Philadelphia this year in the fall. So on the physical side, the neat thing about marathoning is the marathon training. And I know you used to do, so I think weren't you like an ultra runner or something like that? So
Sure.
You know exactly what I'm going to say. That right there kind of covers three legs of that stool right there, because there is a spiritual aspect of it. There's certainly an emotional and mental aspect of it, and then the physical aspect. But then on the pure sort of mental side, I love languages. I mean, I am studying Italian constantly. I'm getting better at it. I'm fluent in Spanish, but I didn't grow up speaking Spanish. I learned Spanish after leaving the residency program. So I really like the mental sort of stimulation of languages for not only the exercise, but also how it broadens the world of your ability to meet people and communicate. And then we didn't really touch on it. You mentioned it very early on about humanitarian work and so forth. We haven't really talked about it, but on the sort of spiritual, emotional side as well, I think that volunteerism is just so critical as a sort of a wellspring of vitality to everybody. And in fact, when folks get to that point where they start to say to you or me or colleagues or maybe a spouse or partners in the practice, like, is this it? What else? And someone might call it burnout, or maybe it's on the path to burnout or something. It's volunteerism is the antidote. Volunteerism is the antidote. Get involved and reconnect with things that are important to you, So, I see folks here in Philadelphia who clearly have some issues. There's some homeless folks, and certainly with all the years of medical mission work, it's an opportunity to give back. And so those are the things that sort of recharge me, and I try to sort of stay involved on a continuum of those things so that I never necessarily feel like I need to sort of get back on track. And I think that's maybe an important message that I would like to share in this format is that we all get off track to a certain extent at points in our life and careers. But I think if we embrace a holistic view of our lives, we can sort of be doing things and staying even keel in real time without getting too far sideways where we have to do a big correction, which then is sort of like trying to, turn an ocean liner around in a stream. You can do it, but it's going to take about 123 3-point turns, right? And you just kind of keep going. So my approach is to try to stay in harmony along the way rather than get so far sideways that I got to try to get myself back standing up.
I think that's a wonderful formula. Thank you for laying it out like that. I would love to do justice to your mission work. And I was just thinking, I interview a lot of docs that mission work is part and parcel and central to their life, right? I mean, Dr. Dan Hatch, he goes down twice a year. Oh yeah, he goes down twice a year to Mexico with Chip Sutherland and that group. Maybe what we do is get together a few people that like to do mission trips, and we'll have another podcast, just talk just about mission trips.
Oh, I would love to. I would love to. And right there in Arizona, you have Todd Gunzy and Todd Haddon, who I practiced with for 7 years there. And Gunzy was the founder of our team, and Haddon Todd Haddon and Todd Gunzy. Todd Gunzy was our founder, and we have incredible friendships based on, of course, common interests, but that the unity around altruism, and a sense of vocation. The word doesn't get banted around as much as it used to, maybe a generation ago, but vocation is what is calling someone like Dan and other folks. I'm sure if you pinned them down, hey, what moves you to do that? And they'd be like, well, it's just in me. It's just in me. And that what's in you is vocation. And as you get into private practice and you get going and you got to produce and you got bills and you've got fixed costs and things like that, it's easy to sort of get on what I call the treadmill to nowhere. So you're running. It kind of seems like someone's bumping up the incline or maybe bumping up the speed on the treadmill. But at the end of the day, you're still looking at the same window, right? You're like, okay.
Absolutely. Yep. It's funny you say that. I tell my students if they fall behind in their studies, the treadmill tilts up and it gets faster all at the same time.
Oh, there you go. And then you tell them, well, now I want you to do a 90-minute workout. And by the way, you're going to end up in the exact same place you started. Just be sure you get off and towel it down, right?
There you go. Well, Luke, I want to thank you. I want to thank you for carving out time. I know it's the holiday season. And it's been such a wonderful discussion. Thank you for all you do for our profession. And Luke, I'm going to send you one of these Dean's Chat cups.
Thank you. Wonderful.
We're welcome.
Listen, Jeff, thank you, because my pleasure to participate, but you're doing it for the profession. I mean, you are improving and spreading the message just by even what you've created here with this type of format, because it's just an amazing profession, and the visibility you're giving and the context by the diversity of voices talking about their experiences is really, it's a tapestry, right? It's a tapestry of all these incredible sort of people and their experiences being woven into the same piece of art. And that's what communicates to folks. And that's where they'll see, wow, there's something in our profession for anybody in healthcare, and what an integral part of healthcare we are. Thank you, Jeff. Have a wonderful holiday season. And I would love to do more with you if you would like to, with some other folks who are involved in humanitarian work and so forth. That'd be a great conversation.
Oh, I look forward to that. Thank you, Luke. And to all of our listeners out there, if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. If you're watching on YouTube, by all means, become a subscriber. And until next week, Luke, thank you so much again. I can't tell you how much I enjoyed this today. Cheers, everybody. Cheers, everybody.
Have a great holiday. Bye-bye now.
You too,
Thanks,
Luke.
Jeff. Yeah, bye-bye.